If you've suffered from chronic back and neck pain for years, right now may finally be the perfect time to get relief in a natural way. So we've invited our expert in relieving that kind of pain, Dr. Christopher Miller, here to talk about the options that he provides. And today, well, we are also meeting one of his patients, Maureen. Today we're talking about degenerative discs, chronic neck and back pain, and some of the common treatments that are out there. So welcome to 8 West.
Thanks, Terry.
Okay, so let's talk about this degenerative disc disease. What exactly is that?
Well, Terry, we all have 24 discs in our spine, and the discs, if you look on the models, are actually pads and spacers between each vertebrae, and they're there to act as a shock absorber. So when we're moving around, it absorbs stress and shock, and also a spacer so that these nerves coming out have space and don't become irritated. But when we encounter stresses in our lives, and that's physical, chemical, and emotional stresses, and it's not addressed or we don't really take proper care of our spines, the discs actually start to dry out, and that's what causes them to start degenerating and thinning down. And a lot of times as patients start getting into this stage here, you can see the disc is very, very thin. The opening for this nerve is very small, and it pinches the nerve. And as I push, you can see how brittle and hard that disc is. So this can be a very painful condition that can affect the neck down to the lower back and hips. And when you start pinching those nerves, it can also affect the extremities, whether it's into the arm or into the leg. It could be shooting pain, numbness and tingling. Sometimes it's extreme weakness in the extremity. It makes it difficult to function.
Yeah, and so, some of the common treatments that are designed to maybe get rid of the pain without fixing that problem, that can almost leave a patient with other problems.
Yeah, and a lot of times it might start with drugs or medications, maybe physical therapy. With that, a lot of times they're trying to increase the core strength, so as gravity pulls, it's not compressing on the nerves as much. But in worst case scenarios, patients might even start going to pain clinics, having to get injections in their spine. Those have many side effects. The worst case scenario at the end would be neck or back surgery, and many times, depending on that patient's situation, these treatments, like you said, treat the symptoms. They're not actually fixing or regenerating the discs, and that's why that problem persists over time, and patients get very frustrated.
Right, so Maureen, let's hear your story. How did you end up coming to see Dr. Miller? You had been in pain for many, many years.
I have, yes. And it's interesting because I saw this show one day, and he was the guest on it, the guest speaker, and I listened to what he said, and I found it very interesting, and I felt that what he was saying definitely pertained to me, and that maybe he had some answers that I previously was unable to have answered and have my pain addressed.
Yeah, you had been in pain for a long time, a number of years, in fact, and you even had a fall at one point.
Yes, and that injured my lower discs, my lumbar discs, and so yes, I was dealing with pain that affected all aspects of my life, really, from sleeping to walking, moving, everything.
Yeah, it's just chronic. It was going on all the time.
Yes.
So, Dr. Miller, exactly what was Maureen's diagnosis, and how have you been able to treat her?
So when we met and talked about it, and I found it interesting because she'd been seeing a chiropractor for quite a few visits, getting adjustments, and it just wasn't getting better. But after we spoke, we did an exam on her back and hips. We took a couple x-rays, and unfortunately, we did find that she had some pretty severely degenerated discs in her lower back. And she was a prime candidate for our decompression program. This is one of the conditions that our program actually helps to fix. And so we're able to offer that to her. And she actually just finished last week. And I think she's very happy and able to move around a lot easier with far less pain.
Let's talk about that, because we see the this specially designed machine that specifically was programmed to help you with your specific case. So how was it going through this process?
First of all, it was very interesting, being able to experience it. But there was change very soon in the beginning. I could feel the change, the lessening of pressure, the symptoms of pain that I had, such as burning and such, began to lessen quite soon.
Was it pretty quickly that you, after the first couple of treatments, that you started to feel the relief from that chronic pain?
Yes. Yes.
Yeah. And so what was happening with her body that was allowing this pain really to start easing up and then eventually going away?
Well, we had worked on her lower back, Terry, and the way the machine works, it gently stretches those areas that were damaged and degenerated to actually draw moisture and nutrients back into Maureen's discs so that they started to rehydrate and thicken up. And by doing so, that created more space for the nerves and also made those discs more of a shock absorber again, where it had some cushioning effect so that it's easier for her to walk around and live and do her everyday functions.
And so what's going on now? So you went through the process with the DRX 9000. Are you doing the spine force?
Yes, I have finished that also.
Okay.
And that was very good because that helped to strengthen, you know, my core muscles and helped with my balance, which was quite bad because I wasn't moving easily. So I feel stronger. I'm definitely on a path that I like now. I can stand, I can walk, I can sit, all of these things without pain that previously I couldn't.
When you first saw Dr. Miller on 8 West, were you thinking, that sounds too good to be true?
No. I thought,
you were hopeful.
I want this.
Yeah. Wonderful.
Yes.
Yeah. And so when someone like Maureen comes into your office, I know we have seen your office, you have so many different pictures, testimonials from patients that you've been able to help. How does this make you feel?
Well, it's awesome, but I wish we could help everybody. You know, everybody doesn't have a problem that this can help with, so it's always important, Terry, that we diagnose their condition properly and make sure we know what's causing their pain before we start offering treatments. But I've been doing this for over 13 years with decompression and just had our 16-year anniversary of our practice, so it's been thousands of patients that we've worked with over the years and been able to help them avoid the surgery and the shots and enjoy life again.
Yeah, what's your advice to people who maybe think they've tried everything?
Come, give it a try.
Fantastic. And if people are interested, Dr. Miller, I know you offer specials to 8 West viewers.
We do, Terry. So if they call our office today, they can schedule a consultation with me, and for $47, we'll do that, as well as an examination to start diagnosing their condition. And the first 3 callers, we're also going to throw in a free hydro massage in our spa so they can start to relax and feel better right away.
Yeah, that does feel good, doesn't it, to be on that hydro massage table?
Yes.
Definitely a reason to be one of the first 3 callers. Thanks so much for stopping by, and congratulations, Maureen.
Thank you.
I'm glad you're feeling better.